issues that are coming out because of coronavirus. Today, we're going to focus on teeth. How are you managing without a dentist? It's one of those critical services that most of us can't get access to at the moment because of Covid-19. And if you have to cope with a toothache or a wobbly filling, or maybe you've just bitten into a nut which has cracked your tooth completely, what can you do? Joining me now is Dr. Kunal Patel, the owner of Love Teeth Dental Practice in Surrey. He's happy to take your questions, actually. So if you have any about them, quick, you got 20 minutes, 81869. But he's also going to explain to us why clinics are shut. We've also got Eddie Crouch, the Vice Chairman of the British Dental Association, here as well. Eddie, morning, going to come to you in a moment. But first, Kunal, the first question is, what can people do in this situation, and why are you shut?
Good morning, Cass. Thanks for having me.
No problem.
What can people do? Well, we've been advised that at the moment, obviously, to stop the spread of the COVID-19, what we have to do is just try and do as much advice and remote prescribing as possible. So currently, the guidelines are if you have a toothache, call up your local dentist. They'll triage you over the phone. If a telephone call can't help with the problem, then currently, unfortunately, we only have the means of calling 111 on your behalf and trying to get you to an urgent dental care hub. Unfortunately, there are not that many being set up as of yet. We're supposed to have had many set up by now. For example, in my area, there doesn't seem to be one. So we're getting phone calls every day from our patients, and unfortunately, we can just try and give as much advice as we can over the phone. And that's where we're at the moment, unfortunately.
It's not an ideal situation, to put it lightly.
No, I mean, it's a shame because obviously our patients invested a lot of time with us over the years, and I feel they're feeling as if we've abandoned them. And it's not up to us. I mean, every day, every single phone call comes, and I know this patient on the other end of the telephone line, and they're in, really bad tooth. I don't know if you've ever had toothache yourself.
I have when I've had my wisdom teeth come out, and honestly, I've wanted to punch a wall just to feel something else, if you know what I mean.
Exactly. And now imagine you're phoning up your dentist, who's supposed to be the person to help you, and all their advice is going to be please just do warm salt water gargles and head down to your pharmacy and pick up a prescription. It's not what you really want to hear, because it most likely isn't going to help that pain, isn't it?
No. Okay, Kunal, do me a favour.
Yes.
You said you've been having these calls already, haven't you?
Yeah.
What are they saying? What are people saying? What are those problems people are having? How bad are they? And what are you telling them?
So many times it's going to be I have a swelling, an abscess, I'm in lots of pain, or I have a broken tooth, or my filling's fallen out. Now, what we've had to do is think outside the box a little bit and try and, go back many, many years when I'm sure people used to have to sort of help themselves before dentists were around, hundreds of years ago. So we've gone back to them times where we say, maybe head down to, your local pharmacy, even though they're not around back then, but get some sort of temporary filling material, put it in. What we have done, for example, in my clinic, we've set up a lockbox outside my clinic because we're not allowed face-to-face contact, and we make these little pouches of temporary filling material, a little spatula, and we've just done that off our own back. So if a patient calls up, is in pain, we'll organise with that patient to come to this safe box, pick up this little pouch, and we sort of talk them through how to do a temporary filling in their own mouth themselves. It's less than ideal. The other way of swelling is antibiotics. Now, how much will an antibiotic actually help? To be fair.
Imagine if they've done the filling wrong. I'm getting better at DIY, but I wouldn't trust me with that sort of stuff. And now you're telling me to sort my own teeth out. I know you can't do anything, but that's the situation people are going to be in.
And the anger is going to be directed to us as dentists. And, obviously, what do? We've been told by our chief dental officer to put our drills down. We're not allowed to see someone. And this was 3 weeks ago. Yeah. We were a bit apprehensive, but we understood it's for the better good, is the COVID-19. That's first, that's primary. But we would have hoped by now more urgent dental care hubs would have been set up.
Well, hold that thought for a moment, Kunal. Yeah. Firstly, I've got to say, we have tried to contact NHS England repeatedly, several times for a response. They have not yet got back to us, so we can't get to the bottom of that about the hubs. But I do want to bring Eddie in here. Eddie, I mean, you can chat to Kunal, that would be amazing. But also, what are your thoughts on everything that Kunal's been saying, and why aren't there more of these dental hubs at the moment then?
Well, I sympathise entirely. I mean, my colleague there has articulated the real frustration we've got as a profession to actually deliver some care for our patients. I mean, it really is incredibly difficult. We are trained to actually help people get out of trouble, and the limitations that we've got at the moment are really frustrating for everyone. The real problem with setting up of these clinics is the lack of the personal protective equipment that's been across the whole of the health service. Obviously, the priority for the health service has been to get to that equipment to the front line. Dentistry is at the bottom of a very long queue. We've been frustrated because ministers have come on TV and said that this PPE has been delivered to dental surgeries when it hasn't. We're fortunate here in the West Midlands that one or two of these centres are now up and running, but the amount of PPE that we've got to actually deliver care is going to be fairly restricted.
So PPE is also another issue here as well about this, Eddie?
Oh, massively. I mean, if it wasn't for the PPE issue, we would still be operating in dental practices, but there is a limit to the respirator type masks that we will need, not only for keeping us and our staff safe, but actually to protect patients coming into the practice and not having the possibility of spreading this virus amongst our patients, because the limitations of the equipment is what's stopping these hubs being up and running now.
Okay, it's 10:45 here on The Big Debate. For everyone listening out there, if you have a question, if you have I've got so many questions I want to ask Kunal and Eddie, and I will be. But if you have toothache right now, or if you are in need of some sort of dental advice, quick, you've got 14 minutes. 81869 to text or ring in 03459 440 445, and maybe Kunal and Eddie can answer those questions for you right now. But get those questions in right now. Sorry, what were you going to say?
I would love to start helping some people again, because as Eddie just touched upon, we're designed to be helping people in pain at the moment, and we're feeling really useless. I know we've made ourselves available for the wider NHS, for Nightingale, and to help out where we can, but we do have we have to help our community as well. And PPE is a huge problem right now. And it's not just any type of PPE. We need the correct PPE, which is, I'm hoping it will come soon. Eddie, have you had any response from NHS England yourself?
Well, I know yesterday, and I think in the next day or so, my colleague, the chairman of the British Dental Association, Mick Armstrong, has met with the minister remotely, obviously with no one meeting face-to-face at the moment, and the minister is really well aware of the issues that we've got with PPE. Obviously, as I said at the beginning, the priority has been to get to the PPE to the life-saving sort of frontline services, but we're told that this PPE is there and it's available. It's a real distribution problem of actually getting it out to the clinics where we want to set up these hubs.
I have a colleague who has been allocated as a urgent dental care hub. And he informs me that he actually wasn't provided with the correct PPE, and it was something that he had to source and fund himself, which is quite worrying.
Quite shocking, isn't it, really, that, many of my colleagues are obviously nominating themselves to be these hubs, They have to be a specific type of practice where, you've got a multitude of surgeries to provide the service so you can rotate and keep the service safe. And you've got a car park where people can actually wait outside before they're brought in. Many of my colleagues have nominated themselves to be these type of hubs, but it shouldn't be up to us to actually source this the PPE. It really should be available directly from the NHS so that we can get these services up and running.
We've got a text here from Priya, who is in Oldham. Priya says, I'm a dental nurse. At our practice, we're not seeing any patients, but offering advice over the phone. The dentist will call the patient, and if needed, antibiotics are prescribed, and the patient has to come to the practice. We'll give them the prescription at the door. If it's a broken tooth, then the patient will have to go to Boots or a supermarket and buy a temporary DIY filling material. The process of opening emergency hubs is ongoing, so hopefully patients can see a dentist if they need urgent treatment. Overall, the patients have been very understanding. Priya, thank you for explaining how it's going for yourself and those in Oldham. This is quite similar to what Kunal was saying. I want to talk, Kunal, Eddie, about emergencies then. What if someone has a real dental emergency, like, they've broken their tooth, the tooth's fallen out, or completely smashed their face, or, something that they can't just go to a supermarket and buy something, or just gargle salt water. What can be done in that situation?
So currently, I think dentistry, the main fear was that by using a drill, we create aerosols, which can help, spread the virus anymore. So I feel at this moment in time, what we're having to do is, if there isn't a local urgent care hub locally, we have to contact the 111 ourselves and organise with the patient a clinic to go to. However, unfortunately, most of these clinics will be going to the treatment of pulling a tooth out. Rather than before, we had the luxury of possibly doing a root canal and trying to save the tooth in as much ways as possible. Currently, because of the pandemic we're in, it's literally pulling teeth out. They can't take the load on. If you imagine, there's so many patients out there and very limited number of care hubs. So if you're in that position, there is hospitals available. I think Eddie can probably tell you a bit more about whereabouts they're available. I don't know, Eddie, do you know? Because I know in my area we're not too sure.
The situation is, obviously, if you've got something that really is very severe, so for example, if you've got a swelling that's closing your eye or actually causing you some difficulty in swallowing or breathing, you should take yourself off to an A&E because, something like that could potentially be life-threatening. And I understand that many people are very reluctant to go to hospitals at the moment because for all the reasons you would expect, hospitals aren't the place to be going with anything minor. But if you've got something really seriously wrong from a dental problem, please go to A&E to get that looked at. We don't want people having severe infections that require operations if they're not dealt with appropriately. But if a tooth is knocked out, for example, there are some things that you should need to know. For example, if the tooth is knocked out clean, you can keep that tooth in some milk or in the corner of your cheek until you can get some service to actually have that put back in. Some of those things are being prioritised by 111, so you would get to a service where that could be attended to fairly rapidly. It varies tremendously across the country. We're fortunate here in Birmingham that we have a dental hospital. There are many dental hospitals across the country where they are providing services at the moment. But again, much of this is either triage through 111 or actually the dentist using a local referral system that is being set up to get to these centres.
Thank you very much, Eddie. That's it's quite comprehensive, and hopefully that will give people a bit of advice and guidance on where and they can go and what they can do as well in this situation. Kuna?
One of the problems I've heard from patients is, these temporary filling materials. They're selling out in Boots, unfortunately. So what my advice is to clinic owners out there is, it's great that we're advising our patients to get these temporary filling materials from Boots and Superdrugs. However, they are selling out and the prices online are quite high. So my advice is, if a patient needs a temporary filling material, roll a ball up of, dentists know what material it is, put it in a pouch and ask them to collect it from your clinic. It helps them a whole lot more, and it will help them save a lot of money as well.
Thank you for that.
That's really good advice. Many of my colleagues, because they're obviously not providing routine face-to-face treatments at the moment, are being contacted by places like local care homes and various other things that are also struggling for PPE. And, it just speaks volumes for the profession that many of my colleagues are actually donating some of their own equipment into care homes to actually provide safe care in the care homes. It's not ideal. But it shows the profession for the caring profession that we work with.
Yeah. So we've donated all of ours, masks, gloves, everything's been donated from our clinic to local care homes and actual funeral parlours, for example.
Quite sad. So I had a message here from Mala. And fair enough to Mala, I want to know. But what do the pair of you think? First and foremost, Mala says, people need to look after their teeth better. For example, brushing them twice a day, flossing daily to minimise the dental issues. A&E will most likely see you in an emergency otherwise. What do you think of that? And do you recommend people going to A&E in an emergency? I mean, Eddie, I know you mentioned it, but is that really the right thing to do?
Well, I think going to A&E really is for the things that I've described, where, for example, you've got uncontrolled bleeding in the mouth, where you've got swelling that's actually closing an eye or causing you difficulty with swallowing or breathing. Those are the sort of things that A&E will be able to help you with, but they're not going to be able to help you with a broken filling or a rough tooth or maybe some gum problems that you've got. That's not the appropriate place to be going to. But yes, people often come into our surgeries and say that they haven't got the time to look after their mouths properly. Well, I'm afraid that's not a very good excuse at the moment. You've got more time than you need. So that you should be making sure that you carry out really good oral hygiene procedures, on a daily basis, twice a day, including brushing and cleaning between your teeth with other things, so that you reduce the risk, really, of having any dental problems during this period.
Had a message from Dan in Berkshire, your neck of the woods, I think. Kunal, we are all proud of you and your team helping in these hard times and all the great work the NHS are doing. That's from Dan for you, Kunal. Right, we've only got a few minutes left, but I want to talk a little bit about finances because dentists are businesses as well. And if the clinics are shut, but as we've seen from Priya before as well, dental nurses are still there, people are still there. Are they getting paid? Are you getting furlough pay from the government? Is it an industry that's struggling at the moment? Kunal, what's going through your mind on that side?
So when we were originally asked to put down our drills, we were informed at the same time by the NHS and the CDO that we were not able to furlough our staff and we had to be ready to be deployed. And that was the entire team. That was a big problem for many of us, as obviously there's a lack of income coming in, and many of us have split NHS and sort of private income. We don't have huge NHS contracts, such as myself. There is that risk that I may not survive if this goes on more than 3 months. So it was a worrying time. We're now about a month into it, 3 weeks to 4 weeks into it, and it's a worry that the statistics from the BDA just came out a few days ago that possibly 1 in 5 clinics may be shut down nationwide and won't survive the COVID-19 if it goes on for any more than 2-3 months. Imagine the number of patients that are going to be left without clinics. I do understand the government has tried its best to help everybody across every sort of field of business. Unfortunately, dentistry has been in the receiving end of not the best end of the stick, if we say it that way.
What would you say? What's the British Dental Association's advice on this? And is there a risk? Is this something that you're aware of, that potentially after this is over, a lot of dental practices will close and people like Kunal are going to be in very difficult situations?
Absolutely. I mean, I would say right at the outset, the information that came out from NHS England was very confusing, and it took many weeks for them to clarify the situation that, for example, if a practice had 50% of their income privately, they could furlough half their staff. That took quite a long time to actually get out of NHS England, and that was frustrating for us. I mean, we've carried out a survey of about 2,500 practices in the last few weeks, and our results of that are that many practices are beginning to struggle, and as my colleague said, he's going to struggle to be still viable if this carries on over an extended period. And we're arguing with the minister to actually go to the Treasury and lift the self-employed level, which is currently set at 50,000. Many dentists earn above that, probably about 60 or 65,000, and so those colleagues are not being helped by the Chancellor's scheme, and we keep on making representation to the Minister to get that changed. There are various other things that dentists are not being assisted with, for example, business rates and getting loans from banks for business disruption. These are very areas that the BDA are campaigning on behalf of the profession for.
Okay, we will wait and see, and hopefully that is something that can get sorted out. It is that level of profession, actually, where it seems like there doesn't seem to be an answer at the moment. We've had one more message.
One more thing, sorry, before...
No, go ahead.
I mean, really, the worry is that before all of this started, access to dentistry was really quite a big problem. If many of these private clinics are closed because of the lack of support, then it's going to put an awful pressure on the NHS after all of this is over, because there just will not be a facility there that will accommodate all these people that have no other practice to go to.
Eddie, good point. Stay there. Don't go yet. I've got two more messages to read out, and I want your response on the second one. Same with you, Kunal. First of all, Syra has got in touch, though, from Tipton, in response to Mala, who said, just brush your teeth and you'll be fine. Syra says, I have very good dental hygiene, but suffer with illnesses which unfortunately cause weak bones. I've had teeth crack and break just by eating an apple. I don't agree with the lady saying better hygiene will stop problems. Syra, thank you for getting in touch. This is the message, though. This message coming in here that I would like both of you to comment on. And I know we're running over a little bit, but the rules are out the window at the moment. Let's just go with it. I'm a dentist, this message starts, in the West Midlands, and I appreciate that dentists are keen to help everyone, but I think it shows a lack of understanding about coronavirus. In other countries with high numbers of dentists, they were told to shut down as well. Toothache is awful, but you have to understand corona can cause death. People need to stay inside. Dentistry is a high-risk environment of the virus being spread. A broken tooth can wait. Toothache can wait. When things are safer, they can sort it out. Swellings are different and can be usually dealt with by a MaxFax team. And I actually think this is part of the government's plans to keep people inside, as toothache is not life and death emergency. What would you say about that? Kunal first.
Okay, so I understand where he's coming from. And of course, being dentists, we understand aerosol virus spread more than anything. We're trained that the amount of PPE we already had in our clinics from day to day was really high. So yes, I do understand. However, toothache can become life-threatening. Okay, if, like Eddie said, if you get swelling of the airways, eyes, this is life-threatening, and people should have access to dentists. Tooth pain, you have to understand, yes, if there are ways that you don't have to go and get help, and we can manage it at home with, advice, analgesia and antibiotics, that's great. But, we have to keep availability open for those people who are at the highest risk, like Eddie said, if they have swellings, if they're in these positions, to go and seek some type of help with the correct PPE available to them. So I think yes, we want to not open every single clinic nationwide, but we should have a clinic in every area available with the correct PPE available for us to help, the wider NHS. We have to understand, if people with toothache and are not advised correctly, that what I find is the population isn't advised properly regarding dentistry at the moment. They're just going to end up going to the hospitals and putting extra load on 111 calls, etc. So I think the advice needs to go out nationwide what to do in the matter of toothache. What we are personally doing all over our social media, we're putting advice out there, so to help our patients what to do in each scenario. For example, if you chipped your tooth, what to do. If you have a swelling, what to do. And if these things don't work, then what to do. So I appreciate the colleague who messaged in saying that, we have to stay shut to prevent the spread of COVID-19 because that causes death. But, a really bad tooth swelling, abscess, etc., can also cause death if left untreated.
Okay, anything you would add to that, Eddie?
Well, I think we all want to provide safe care for our staff, for our dentists, and for our patients, and the protective equipment is the essential factor here. Unfortunately, we work in a situation where we're very, very close to a patient. We've seen from the death, sadly, of the ear, nose, and throat specialists that if you're working in an environment where the viral load, what you actually take in from patients is high, then the risks to the staff is just not one that we want to take. And unfortunately, this morning I'm hearing through the British Dental Association that a dental nurse has sadly passed away in Wales. So really, at the end of the day, we are talking about life and death situations, and we are talking about toothache. And I understand the caller saying that, these are situations where we need to look at the bigger picture. For someone with toothache at the moment, I'm sure they understand that, but obviously they want a solution to a problem that's been going on for 3 weeks.
Yeah, okay, thank you. It's been good having the pair of you on. Stay safe, and I hope to speak to you again at some point as well. Eddie Crouch there, Vice Chairman of the British Dental Association, and also Dr. Kunal Patel, owner of Love Teeth Dental Practice in Surrey. 11:05 here on The Big Debate.